Hi, everybody. It's Dr. Lisa from Grapevine Health. We bring you trusted and understandable health information. We do that sometimes by talking to health experts. So today we're talking to one of our speaker bureau doctors, Dr. Sara Horton, who's going to talk to us and answer all your questions about cancer. Yeah, how you doing?
I'm doing good, hanging in there. How are you?
Good. So I'm excited for our talk today. It's always fun to talk to you.
I know, me too. It's been a while.
Yeah, so you're one of the doctors on our speaker bureau, and I want to start highlighting the amazing work and expertise for all of you. So I think this will be a really great addition to what we do.
Right.
And I also have a little surprise for you. We are going to invite a community member to talk to you also.
Yay, I love it.
Yeah. So go ahead and introduce yourself.
Okay, so I'm Sara Horton. I am a good friend of Dr. Lisa's. I'm a medical oncologist, and hematologist, which is a doctor that takes care of cancer patients, as well as blood disorders. But I personally do mainly cancer, all kinds of cancers, and tend to specialize a little bit in breast cancer. Um, so yeah.
So what's an example of a blood disorder?
Blood disorder is so when we talk about cancers, we tend to, as doctors, we tend to divide them into what we call solid tumors or solid cancers. And people may hear that word tumor a lot. And I always get that question: what is a tumor versus a mass versus a cancer? Are all tumors cancers? And that's a problem with just medical speak. Usually, when we say tumor, we mean a cancer, a mass that is cancerous. But if you hear mass, like a doctor tells you, oh, there's a mass on your scan. Well, a mass can be not cancer. It just means there's something that is usually on there that shouldn't be on there. And
Mhm.
so they need to figure out by either a biopsy or something if it's cancerous or not. So usually tumor means cancer, mass could be either one, and you need to find out for sure. So I guess I need to go back to your question, right?
What an example of just maybe one or two examples of a blood disorder so that we help people understand.
Okay, so blood cancers are leukemias. When you hear people talk about leukemia, that's a cancer of one of the blood cells. Um, Lymphoma is another type of cancer of one of the blood cells. So we call that a blood disorder. And these are all cancer type blood disorders. Um, then you can have, so leukemias and lymphomas are the most, and multiple myeloma is a cancer of one of the blood cells. So then the non-cancer blood disorders are things like sickle cell anemia, which is a disease of the blood cell. It's not a cancer, though. Things like iron deficiency anemia. When you hear anemia, people say my blood count is low. That's usually your red blood.
Yeah, I've heard that a lot. I have low blood.
I have low bloods, and usually the most common is iron deficiency, meaning you're not getting enough iron in your diet. And you can have other types of reasons for being anemic, but anemia is a blood disorder. Then there's other things like that are less common, meaning you can have something if your white blood cells are low called neutropenia. We don't hear about that very much, or thrombocytopenia. So any,
Which is low platelets.
which is your low platelets,
And the
which are
platelets help clot your blood. So
like
you won't bleed to death if you scrape yourself.
exactly,
Yeah.
or bruise, right? So
Yeah.
so those are the blood disorders.
Cool. So, people often go to Google when something's wrong. And when I ask people, well, once you go to Google, do you have the answer? Do you know what to do after you Googled your symptoms? And a lot of them say, no, I think I have cancer.
I know.
So,
So do I.
um,
I'm just
how can people learn whether or not they have cancer? I know it's a scary thing. And so I think you can help allay people's fears about having cancer.
so The most important thing to do, honestly, if you have a suspicion, if you think that you may have cancer, of course, you got to get yourself to a doctor. And what happens is usually the opposite. People become afraid, they feel a lump, they think this is cancer, and then they just say, I don't want to, I don't want to know, I'm not going to the doctor. And you just wait until it gets to a point where it either is hurting or it's blocking something, and then you go to the doctor. But the thing that I want you to, I would want people to know is that usually it's not cancer.
Woo!
Yes, usually it's not. And honestly, even I'm an oncologist, I do this all the time, but there have been times when I felt something and I thought,
Every time I feel a lump, I think it's cancer, right? I mean, it's a human response, isn't it? We're all afraid to have cancer.
absolutely. But, it's important then to follow it. So I know, being a cancer doctor, the things to look for. But if you're not a cancer doctor, then it would be important for you to contact your doctor, find out what it is. Majority of the time, they're going to make you feel much better because it usually is not cancer, and they know that, and they can tell you that in a way that you may not know. So that's what I would say.
So that's just a little teaser. We're going to have you back on to talk regularly, and we'll talk about different kinds of cancer. We'll take questions from the audience. But today, what we want to do is bring in a community member because, Grapevine Health is all about elevating voices of the community and hearing directly from the people we serve. So I invited a very special guest, if we can see him, Dwayne Boyd. And you've met Dwayne
I
before.
know.
So Dwayne's one of my community friends, and he and I had quite a few discussions about cancer. And so he helped me recognize the need for us to really explain to people what's going on when you have cancer, and also talk about some of the cancer myths. So how are you, Dwayne? Welcome.
I'm doing well. How are you guys?
Good.
Good.
So I want you to jump right in and
I'm going first. Wow. Okay. Thought it was ladies first.
Well, we've been chatting a little bit. So
Oh, okay. All right. Okay. Gotcha.
But just jump right in. Just if you want to say a few things about yourself, but I also want you to pose your question to Dr. Sara about whether or not you should get cut if you have cancer. So.
Okay. Well, my name is Dwayne Boyd. I'm a native Washingtonian. I am 56 years old. Gay Black man. I've had cancer several times, as well as being HIV positive. So, and I got my COVID vaccine yesterday.
Yeah.
So, excellent.
Yeah. Well, cancer has been very prevalent in my family. My grandmother and all of her 13 siblings all had cancer and died. My mother and her siblings had cancer and died from various forms of cancer. So all through my life, the phone would, at various points, the phone would ring, my mother would answer it, and we get the news that so-and-so died, and that person died of cancer. And my mother would always say, well, did they cut him or did they cut her? Because, once they cut you, the cancer spreads and you die. So this is something that I've heard my whole life. So even my cancer experience, my doctor told me you could be cancer-free, but if we perform surgery, but I would never let him cut me because that had been so ingrained in me that just the thought of them cutting me would give me a panic attack. So my question to you is this true that, if they cut you, cancer will spread and you die? My oncologist said that this is a myth among the African-American community that makes it very hard for him to treat his African-American patients. So what's the truth behind that?
Okay. The short answer is that it is a myth that if you cut into a cancer, it will spread. And the beyond that, because I've heard this in my family as well, is that you cut, it spreads, it goes everywhere, and you die, and that's it. But with most myths, it's based in some truth. And so the truth is that there is the ability for, if someone Okay, let me go back. The way the cancer spreads, right? Usually cancer spreads when the cell gets into the bloodstream
Okay.
and or it can get into your lymphatic system. That's why we talk about lymph nodes. And
Yes.
one of the cells will get in, it'll spread to another part of your body, it'll start to grow and then can spread from there. Um, some cancers are located very close to a lot of blood vessels.
Okay.
Certain cancers like pancreatic cancer and liver cancer, we call them vascular because vascular is just another name for blood veins, blood vessels. Oh my God. So, and so the tumors that we know, and kidney cancers. So those tumors that we know that tend to be located to very, very vascular areas, we are very careful about biopsying them because in very rare cases, they found that they seeded. So if they weren't careful, if they, did the biopsy in a way that wasn't precise, that a cell could get into one of either the blood vessel or into a lymphatic and spread.
And
So
that's what you mean by seeded, meaning a piece of the tumor gets into the bloodstream. And a biopsy is what, Dr. Sara?
biopsy is when the doctors go in and they either with a needle or sometimes they have to go in surgically with a knife and cut a piece of the tumor or the mass that they're seeing to find out if it's cancer or not. And that's usually the first thing that's done before a diagnosis of cancer.
Okay.
So saying that it's, it's kind of based in a little bit of truth and knowing that there are some tumors that are have the propensity if they're not if the biopsy or whatever's being done is not performed in the correct way of potentially spreading. That's why we have what we call oncologic surgeries, right? So we call the oncologic surgeries just another name for cancer surgeries. Every time a surgery is done for cancer, it's done in a very precise, specific way to minimize, for one, to get as much of the tumor, well, all of the tumor if possible, or as much, and in a way not to cause spread of the tumor. So I have sometimes, for example, gallbladder cancer. I'll have a patient come in and say, you know what, I had a problem with my gallbladder and they took it out and, oh, they found there was cancer in it. She's like, well, it was all within the gallbladder. So can I just stop there? Well, that surgery was not a cancer surgery. They went in to take out the gallbladder because they thought it was just a stone or something. There are things that you need to do when there is cancer to help prevent the cancer from spreading to other parts. And so that's an example where they have to go in and they have to be very precise and they have to remove a part of your liver because your gallbladder.
Oh, you went on mute, sorry.
Sorry about that. And so, so the way that the procedures are done these days, a surgical procedure for cancer is done in a way that minimizes the spread. And so, I say, in contrast to that, it's much less likely, like your doctor was, sounds like trying to explain, if you have the surgery, it's less likely that the cancer would spread if it's done in the correct way.
But is that a medical advancement, Dr. Sara? Because these myths sound like they are from decades and decades ago before we had certain protocols and so on. So how long has it been since you've had this process in the operating room to protect the cancer from spreading?
It's evolved. It's been around at this point for decades, honestly. It's been around for 10, gosh, every time I say 20 years, I forget. It's 20. And so it's been around since, the 30s and before.
Oh, okay.
And I think people, as the surgeons have learned about how they can perfect their surgeries, even with breast cancer, in the 60s, they would remove the entire chest wall I mean, they felt that all of that, the breast, the chest wall, the muscles, had to be removed to prevent the cancer from coming back. But as we know now, as we learned how to do things with, you had better tools and you learned to be more precise, you can just remove just the tissue, just the tumor, and you can sometimes leave the entire breast still.
Yeah.
I think the other part of that myth too is comes from the fact that there are times when someone may have been diagnosed with a cancer and the doctor, saw that on the X-ray or the CAT scan, the cancer, and they thought that it was something that they would be able to remove and it would be okay. But then because CAT scans can only detect a certain level, sometimes the cells are so small they don't show up on the CAT scan. And the doctors don't know, they only know what they can see until they open up. And then they'll open up and there may be small cancers all over the abdomen, all over the area that they open up that they had not seen on the scans. It was unexpected. And when that happens, when it spreads like that and they know they can't remove it, they have to just close up the person and have that conversation. And I think that has happened in my family. I know I've heard it more than once where they've said they opened them up and they're all over the place and they closed them, and so.
So people think it happened because they opened them up when actually it had already spread because they waited too late and maybe they didn't get tested or go to find out what is that knot? Why do I have this pain in my back? Like why am I having diarrhea? Why is there blood in my stool? So
Exactly.
That's what's happening.
Dr. Lisa, may I ask a question?
Of course. This is about you today.
So Sara, so do you find that this myth is more prevalent among the African American community? And if so, why?
Yeah, I do. I don't know if it's because, I primarily treat African American patients, but over my career, I've treated, all types of patients. And I definitely find it in older patients across the board.
Okay.
Doesn't matter. Because cancer in general was something that wasn't talked about very openly amongst all races because there wasn't a lot of, in terms of treatment, it was a very scary disease. People were ashamed when they were diagnosed. They didn't know why they had it. And there was so much not known that people just decided to, not only talk about their condition, they just started developing these myths about it because, not only what they didn't know, but we didn't have a whole lot to offer people in the very beginning.
Right.
And so when there wasn't a lot, people would kind of say, it happened because, and so that's how a lot of the myths got started.
Okay.
Okay, so Dwayne,
yes.
One of the questions that I'm getting a lot from cancer patients, not only patients who are currently on treatment but have had cancer, is there's a concern or fear about receiving the COVID vaccine.
Okay.
And so I was so happy to hear that you decided, but tell me about your process and how you got to that point of saying yes.
With the vaccine?
Yes.
Well, I had already had it once, and I'm lucky that I had a very mild case. I guess for me, people are dying, and this virus is spreading. We've got this huge pandemic, and I thought, they say it's 95% safe. They've tested it. I know they kind of rushed to get it out. A lot of people are saying, I'm going to wait and see what happens. But for me, just this living in fear, the isolation, the masking. Of course, I'm still going to do those things, but it was just the fear was so overwhelming for me, and I just didn't want to live in fear anymore. And I weighed the taking the vaccine against getting COVID, and taking the vaccine won for me. I just felt that the risk of taking the vaccine was far less than the risk of catching COVID. And this is my second pandemic. I lived through the AIDS pandemic, and I remember the various medications and treatments that came out. When I tested positive, the only thing that was out was AZT and DDI, and they were very toxic medications. I remember taking them. I remember I had a Rolodex. Maybe some of your viewers are too young to remember Rolodex. I had a Rolodex that was full of my friends' names.
Excuse me.
Some of your viewers, not you, but some of the viewers. I had a Rolodex that was full of my friends' names, and as they started to die, I would just pull their cards out, and eventually it was a very thin selection of people in the Rolodex. And I just said, I don't want to go through that again. I'm going to do what I can do to survive this thing as quickly as I can do it. So hopefully I've made the right decision. I feel confident in it and that I have. I just maybe just the belief that it'll work will have a placebo effect and help keep me safe.
When did you have it?
Friday.
Okay, so have you had any side effects?
The area where the injection was is sore. I've had the same reactions as a flu shot. So the first day I had a little fever, some lethargy. I was tired, a mild headache. The next day,
what's lethargy?
Lethargy is tiredness, isn't it?
So tired.
Am I correct? Yeah.
Very medical term there.
Oh, is it? Okay. Sorry. Sorry to be so medical. I'm not a doctor. I just play one on TV. The site was very sore. I got it in this arm, and it's sore. Like the next day, I could barely lift my arm. And then now it still hurts a lot. So it's really swollen. It hurts a lot, more than the flu shot did. But still, they give you a sheet. They tell you all the things to look out for. They say it should clear up in 2 to 3 days. It's very interesting. A neighbor of mine, an elderly gentleman, got one maybe 2 days before I got one. And yesterday, his brother called me to say that his nurse was there and he couldn't reach his brother. The phone was ringing busy and he was probably off the hook, whatever. So I went to knock on his door and he was yelling, saying he couldn't move, he couldn't walk. So we had to call the paramedics, and his brother came in and he was yelling, oh, it was that COVID vaccine. I knew he shouldn't have gotten it. And it was just blame it all on the vaccine. And I got a little scared, and turned out that this gentleman's blood sugar, he's a diabetic, and his blood sugar, I think he said that it should be between 100 and 120. His blood sugar was 680.
Wow.
Wow, that's such a wonderful, wonderful example, because we're hearing people talk about these horrible side effects from the vaccine, or even during the research trials, there were things like that happened and people were blaming it on the vaccine. But the truth is, if you get a population of people, they will have issues that come up. So I'm so glad you shared that example.
Right. So we just can't be rushed. We can't rush and blame everything on the vaccine if you have underlying health issues, especially if you aren't doing what you're supposed to do.
So thank you both for coming on our inaugural community conversation chat.
Yay.
And stay tuned for more conversations like this with specialists from our speaker bureau. And please don't forget, we need 1,000 subscribers before we can go live on the street with Dr. Lisa on the street. So please hit the subscribe button below.
Okay.
So until next time, see you later.